Hello and welcome back to Pittsburgh Living on KDKA TV. I'm your host, Carol Lee Espy, and today we're featuring 7 excellent tri-state businesses. And coming up, we have Greg Slepecki from 101 Mobility. We have Dr. Nathan Lockery from AspenDental and Cookie Harris from newIMAGE Hair Clinic. But right now, let's welcome Dr. Ian Bulow from Revive Upper Cervical Chiropractic. Welcome to Pittsburgh Living.
Thank you for having me.
And we do have a name change.
We do. It's kind of an exciting time in Cranberry Township. The clinic is kind of evolving into our new brand of Revive. It's an interesting concept. The Upper Cervical Health Centers was our prior name, and it's a great brand, and it really speaks to what we do, but it's very technical, where Revive speaks to our purpose, and that is really to restore health and life to folks, you know, and I think it really speaks to the need of our culture and where people are at in their healthcare journey.
Yes, I think it's a little bit more of a complementary look between, you know, body and mind, as opposed to separating the two.
Yeah, absolutely. And let's face it, the biggest problem is that we are looking so much today in our culture outside of ourselves for our solution. Yeah. And probably the biggest hindrance that most people face, number one, is realizing that what they're doing is just not working. I mean, we get around and we go from one doctor to another doctor to another doctor.
Take a different pill each time.
Now, don't get me wrong, medication saves lives in a state of crisis.
Yeah, sure.
But there's a problem when we go in for one condition and get a pill, and then come out with 5 different medications to counteract all the side effects of that original. Yeah. And we're really not any better for it. You know, in the United States, we consume more medications than anybody in the planet as a country. And our death rates and our morbidity and mortality rates, how good we feel, how long we live, they're not all that impressive. And so what we really need to do is take accountability and responsibility for our own health. It's not going to come from a doctor. It's not going to come from a pill. You've got to start changing what you're doing if you expect to really get your life back.
Yeah. Learn more about what your body is and how to take care of it.
Absolutely.
So where do you fit in all of this?
So when we look at the body and how it works, we have to recognize that the body is really quite infinitely intelligent. I mean, if a developing fetus can grow in a mom, right, and all the mom uses
it's pretty amazing.
Is pickles and ice cream over 9 months, and we have a brand new infant child. I mean, that's a miracle. Life is a miracle.
Life finds a way.
It does, and it's completely governed by our brain. Our brain has trillions of cells and neurons that keep us alive, keep us breathing, keep us balanced, keep our digestive systems running, and that is all run through the nervous system. So when we look at the models in here, we have to realize that our brain sends messages to our body much like a computer system does.
Yes.
And the problem is people through injuries, car accidents, concussion injuries, slips and falls, sprained and strained necks and backs, will twist the bones that are designed to protect these nerves.
That's the highway.
It's a super information highway.
It is. It is.
And so when that twists out of line, our brain is no longer able to communicate with our body. And we find serious ailments as a result. Seizure disorders, migraine headaches, dystonias, torticollis patients. Last time we were here, we talked about trigeminal neuralgia, the pain syndrome.
Yes.
Vertigo issues.
Yes.
Chronic digestive issues. These are things that are signs that your body is telling you, hey, we have lost control.
Yeah, something's out of kilter.
Absolutely. And our role in upper cervical work is to restore that control. Put the brain back in control so the body can sequentially regain its health and function. Okay. It's a pretty exciting line of work.
And so we're looking at the spine here, which we at first it kind of looked like a set of all the alien creatures.
That's right, yeah.
But we're looking at the spine here. So going up from the hip all the way to the top, it just shows exactly what the upper cervical
So this would be your whole spine here, and it's a one movable unit, right? You've got all these little segments in between, but they all will obey the weight of your head. And the upper cervical is this one very small, delicate place in the very, very top. And what most people don't realize is that when they have lower back pain and they have sciatic pain and they have all these muscle spasms in their spine, what we have to realize is that the whole spine is holding a bowling ball on the top of it, right?
It is.
The weight of your head is about the weight of a bowling ball. So if the weight of the head tilts off center, your entire spine has to restore the center of gravity, which is going to cause your shoulders and your back and everything to go into spasm. So even if people have shoulder and back and lower issues, very often those are compensations for this weight of the head being shifted off center.
That's pretty amazing. I mean, you think of it with an infant, you can see that more readily because the head is so
it's so large.
And you think, how does this ever?
And think about this: when an infant is born, it's such a traumatic process, and we wonder why kids have colic and ear infections and ADD and bedwetting. I can tell you that we've seen all of the above in the clinic. And when you take that pressure and remove it, the body relaxes, so they're able to go to the bathroom more regularly. Or folks with hyperactivity disorder are able to calm down. Or little kids that have bedwetting issues are able to sleep through the night without their neurons hitting the bladder. They're able to actually calm down. So it's a pretty exciting line of work. And the biggest thing that I find is that we just have to face the reality that, look, if we have a chronic issue and we're taking medication all the time,
and it's not working,
why don't we look to the spine and see if there is a irritation there that could be causing the problem? And if there is, let's very gently and very safely remove that pressure to allow the body to regain its natural normal function.
So where are you located?
So we're located in Cranberry Township, and we actually, with our rebranding, with this new brand of Revive Upper Cervical Chiropractic, we are hosting 2 very special seminars next week in the practice. And so we're inviting everybody to come. It's a complimentary registration for the seminar. We're going to answer questions, give a tour of our clinic, which is state-of-the-art. All they have to do is contact the office, and we'll get them, reserve them seats.
Okay, and we have your phone number right here.
Absolutely,
and you can also go to the website, and we'll direct you right to your place to Revive. Well, thank you so much for being here.
It's my pleasure.
If you would like to know more about Revive Upper Cervical Chiropractic, you can just give Dr. Bulow a call at 724-772-7060, or you can log on to revivepittsburgh.com. And if you'd like to advertise your products or services on Pittsburgh Living, you can give us a call at 412-575-2400 or email us at showcase@kdka.com. Now, up next, we have Greg Slipacki from 101 Mobility. That is next when Pittsburgh Living continues.